kidneys, and diseases. You have two fist-sized organs inside you called kidneys. Kidneys are very important to keep your body functioning, since they filter waste out of your blood and they reabsorb water from the waste that is filtered out so that you don't get too dehydrated. To understand how diseases work, first it is important to have a basic understanding of how the kidneys work. Blood circulating your body comes from your heart and passes into your kidneys. Small sections in your kidneys called nephrons filter the blood, letting the wastes travel through small tubes where water and nutrients are reabsorbed using a system of gradients. Any waste that isn't reabsorbed leaves your body. What is reabsorbed enters your bloodstream and continues to circulate throughout your body. Your kidneys don't always work this well. Here are 4 diseases that can affect your kidneys. Diabetes mellitus is caused by a lack of the hormone insulin, which stores blood sugar. Without insulin, there's too much sugar in your blood, which means that the kidneys filter it out. However, when excess sugar gets into the nephron, the gradient that allows water to be reabsorbed is thrown off. This means that more water goes to waste, and you'd be more dehydrated because less water is reabsorbed. To treat diabetes mellitus, insulin intake must be regulated by pumps, injection, or diet. Diabetes insipidus is caused by the lack of a different hormone called ADH. ADH allows much of water reabsorption in the nephron, reabsorbing a significant amount of water. Lack of ADH means that most of the liquid waste is excreted as urine, leaving the patient dehydrated and thirsty. The fact that there is not enough water reabsorption is very dangerous because a person gets so dehydrated. Diabetes insipidus used to be fatal, but now patients can take desmopressin, a drug that mimics ADH. Bright's disease is a problem with blood filtration. This disease occurs when, in the capillaries in the nephron, the gaps through which blood is filtered are too big. Larger particles, such as proteins and red blood cells, are then filtered out and let into the nephron's tubules. The high levels of particles inside the tubes of the nephron throws off the osmotic gradient, again causing less reabsorption and higher volumes of urine. To test for Bright's disease, urine is checked for its protein levels. Because Bright's disease is the result of a malfunctioning filter in the kidney, to treat Bright's disease, a patient needs a new kidney that can filter properly. A kidney transplant is done by surgery, where a donated kidney is surgically implanted into a patient. Kidney stones are small, hard stones that form from minerals inside the kidney. Having a stone inside your kidney is very painful, especially if it gets lodged in a passage or tries to leave the body through the ureters and bladder. If the stone is too large to pass through the urinary system without causing damage, it must be removed. This can be done by surgery, where telescopes and instruments are inserted through an incision in the patient's back, or by breaking the kidney stones into smaller pieces by using sound waves. So, 4 of the most common kidney problems are diabetes mellitus, which is caused by a lack of insulin, diabetes insipidus, which is caused by a lack of ADH, Bright's disease, when the kidney doesn't filter your blood properly, and kidney stones, which are painful mineral buildups in your kidneys. By keeping a healthy lifestyle and diet, many of these problems are more likely to be avoided, and then your kidneys can do what they were made to do: filter your blood and reabsorb most of the water in the filtered out waste to keep you hydrated. Thanks for watching!